What we would like to do is, as I mentioned earlier, is eliminate post-secondary tuition. And in addition to that, develop more medical health schools. So also medical health professionals and graduates that come right from BC, preference given to BC residents. We feel and find that examples around the world, when a community provides the education for free to community members at schools that are available in their rough regional upbringing area, they're more likely to stay in those communities. There's a lot more camaraderie and cohesion between those students who come up through the ranks of their community, and they're the best students, and they proceed through a university very close to home. They're more likely to stay there. So that's a long-term goal of achieving greater number of doctors in particular in our area. In the short term, we'd like to see the elimination of the small business model, which has been foisted upon the family practitioner. So every doctor is expected to be a small business person, and what we see are rather inefficient ways of delivering health to our community members. So you have multiple walk-in clinics, each with their own level of administrative bureaucracy, land owning and leasing costs related to that. We'd rather see the government take over that role of operating walk-in clinics and larger walk-in clinics that could realize the grand scale efficiencies of larger operations. You know, looking at also facilities that are operating on a 24/7 basis. Most walk-in clinics now are closed more than they are open, yet it still costs the same amount at night to rent that space as it does during the day. So that's a real inefficiency, and alleviate the doctor's need to ensure that the business is still going. So we'd rather see them have a better quality of life through knowing that they can take 6 months off for their family needs and personal health needs, and know that they have work to come back to, and not have the anchor of being weighed down by the small business model.